Good morning, everybody. This is Ma Barker coming at you from the greater Seattle area. It is Sunday, November 13th, 2016. I am 5 days post-op VSG surgery, and I wanted to touch base with you all and share about how I'm feeling and how I'm doing and how the first 5 days post-op has been going. My surgery date was Tuesday, November 8th, 2016, and my weight, the last weight I took pre-op was 301. I haven't taken a weight post-op. I'll weigh in on my 2-week post-op checkup, but I don't own a scale in my house, and I think that's a good idea because I don't want to get obsessive about the numbers. Although I do work in doctors' clinics and hospitals, so I've got scales surrounding me all day, every day at work. But I don't have one here at the house, and I decided that I wasn't going to weigh myself until the 2-week checkup because I've heard and I've experienced in the past that the number on the scale can really determine how you feel for the day. And I don't want to be depressed. I want to be happy because I'm feeling great after surgery. So it's 5 days post-op. And how am I feeling? I'm feeling great. I'm feeling better than I have in years. On Tuesday, when I was going into surgery, my surgery got pushed back 5 hours for some complications of a preceding surgery from mine. And so by the time I was getting ready to go into surgery, I was really dehydrated. My mouth was really, really dry. So during that time, the nurses came in and asked me, did I want some lemon-flavored glycerin sticks. And if any of you get into the position where your surgery is pushed back or it's late in the day and your mouth is feeling real dry, ask the nurses to bring you some glycerin sticks. And they're just big Q-tips that you suck on, and they don't taste bad, and they moisten your mouth, which you're really going to need because I was really, really dry. They brought me back some lip balm, which was really good. If you don't bring lip balm with you, ask the nurse to bring you some. Bring it with you to pre-op. So between the glycerin sticks and the lip balm, it kept my mouth from being quite so dry. Also, what the nurses did was, because my surgery had been pushed back 4 to 5 hours, they went ahead and hooked me up to an IV before surgery so I could get some fluids in. They just hooked me up to an IV bag, some saline solution, and I think that really helped too from being so dry. So make sure you're comfortable, and if you're not comfortable during the pre-op, then ask nurses what can be done. That's what their job is, and they want you to be comfortable. So I go into surgery about 5 hours late, and surgery went very, very well. 45 minutes in and out. Doctor said it was the easiest surgery he'd had all day, no complications, there were no issues, even the issues that he thought might be a problem, didn't have any issues at all. So my surgery went very quick. However, I do remember waking up in recovery, and the first words out of my mouth in recovery were, I hurt. And I did hurt. I hurt a lot more than what I had anticipated. But as soon as I said I hurt, the nurse rushed over and said, on a scale of 1 to 10, what's your pain level? And I said 9.5. Now, I'm a pretty tough old gal, and I have a pretty high tolerance for pain. So I laid there in pain for a few minutes, thinking, well, could I tolerate this? Could I tolerate this? But I didn't want to, because I didn't want to take the chance of not speaking up and saying I'm in pain and then waiting until the pain was out of control. So as soon as I woke up, I said I hurt. She came over and she administered a dose of fentanyl, and that brought my pain level down to about a 9, 8 3/4. And every couple of minutes, the nurse was right there by my side saying, how's your pain level now? How's your pain level now? And until the nurse brings it down to below 7, they're going to continue to give you pain medication. So just know, if you want pain medication, don't tell them your pain level is below a 7. Say 7.5. So I started getting dosages of fentanyl and compazine for nausea and fentanyl for the pain, and they administered it every few minutes. At least it seemed like it was every few minutes. And it controlled my pain very well. I never, ever experienced the amount of pain after that first dose of fentanyl. I never was in as much pain as I was when I first woke up from surgery. They continually decreased my level of pain. So it was more pain than I had anticipated, and it was more pain than I've ever experienced post-op before, because I've had several surgeries over the years. But they controlled it very quickly and very effectively. So for those of you thinking about going into this surgery, and if one of the determining factors is pain, then don't let it be, because they work very hard at controlling and maintaining your pain level. So would I do it again if that's the only consideration I had was the pain level? Absolutely. I mean, that wouldn't even be a question. So they controlled my pain, and eventually, when I was up enough from recovery, they took me up to my room where I was going to stay for the next day, and everything was fine. The kitchen was already closed, so I didn't get anything to eat. It's probably about 8:30, 9 o'clock by this time. And so all I had was water. I did get some ice chips. I did get up during the night, but just long enough to get up and walk around my room a little bit and sit up in an armchair so I could get up out of the bed. During this time, I kept working with the spirometer, and I don't have it close by, or I'd show you what it is. It's the little tube they give you. It's got a straw attached to it, and you suck on it, and a lot of times if you suck real hard, it'll make you start coughing, and that's a good thing. And for those of you who have never been into surgery before, or think, don't sweat the small stuff, you're going to skip the spirometer, don't skip the spirometer. You should be doing that 10 times in a row every hour. So every hour, make sure you suck on the spirometer 10 times in a row. That clears your lungs so that you don't develop pneumonia from laying in bed. So working with the spirometer is very important. And I worked with the spirometer. I used it and gradually decreased the times I used it until after my first full day home of post-op. And so I did that. I got up and walked, and then the next day, Wednesday morning, my surgeon came by during his rounds and said I had great surgery, no complications, no issues, I was doing great, that I could go home that evening. So I ate a couple of meals, which consisted of a couple of ounces of protein drinking water during the day. I did get some sugar-free fruit punch, and I liked that a lot because I liked the flavor. So I drank, when I say a lot, you know what I mean, maybe an ounce or two. Then I went home Wednesday night, and after my son dropped me off, got everything settled and dropped me off Wednesday night, I was feeling really, really good. So I ran an errand up to Home Depot because I knew I was going to get bored, and I was already bored, and it's the first day after surgery, and I've got 3 weeks of recovery. I was really bored, so I went up to Home Depot to get some small craft projects and some plants and dirt and things so I could start growing a garden. Then came home Wednesday night, took my medication, went to bed. Now, Thursday, got up, did the same thing, drank my broth, my protein drinks, and my water, and I walked 4 times a day. My doctor, on the post-op care list, they want you to ambulate every hour. They want you to get up and take a walk every hour. Well, that's not going to happen. Not because I can't do it, it's just because I'm too lazy to do it. But I do go about 4 times a day. I ambulate. I go for a walk 4 times a day, and it's a very short, quick walk, just enough to get the blood circulating. It helps decrease the chances and likelihood of developing a clot. Plus, it makes you feel better. I feel so much better after I've walked. I walk to my capacity, which is not very much, but I walk every day, at least 4 times a day. So that's going real well, and I feel great. I have no pain. I've been having spasms in my stomach, and they're real interesting feeling, and that freaks me out every time my stomach starts having a spasm, because I'm afraid it's going to develop into something very painful, but it never does. So what triggers the spasms, I've noticed, is like when I first get up in the morning, or if it's been a while since I've had anything to drink, the first drink, especially if it's cold, refrigerator temp, the first drink or the first whatever I have sets my stomach off into a spasm, and it freaks me out. Is it painful? No, I wouldn't call it painful. It's uncomfortable. I think the anxiety from being afraid that it's going to get painful really ups the ante a little bit, but it's not painful. So what I've been doing is I take my pain medication a couple minutes before I eat, and then I eat after it's had a chance to dissolve and kick in, and that seems to do the trick. So I haven't had any problems with pain at all during these first 5 days of post-op. What I had the most problem with is restricting and limiting my physical activity. I have a lot of projects I'm working on, cabinets and painting and kind of big projects, and I can't work on any of them because they weigh more than 15 pounds, and I'm restricted from lifting or moving more than 15 pounds for the next 6 weeks. So that's a little limiting. So what I did, my second day home, Thursday night, I went to Dollar Tree, and I spent $85 at the Dollar Tree. Well, you can buy a lot of stuff at the Dollar Tree for $85. I bought a lot of little craft projects. I bought, paint and a lot of fake flowers and Christmas ornaments, Christmas decorations, Christmas paper. And so I've been busy doing small things, working on small craft projects. Later today, I bought 2 chairs from a salvage store, 2 wooden chairs that need to be sanded down. So I'm going to get some sandpaper out. I'm going to sand those down by hand. I figure it'll be a good workout for my biceps, start toning the muscles. It's not more than 15 pounds, and it'll keep me from being bored. And I love seeing the finished project, the finished product. After you get something that's really scarred up and beaten up and looks bad, and you take a lot of time and you spend a lot of energy on fixing it up, I love looking at my finished projects. So anyway, so I have projects. I have a lot of projects I can work on. And I've just been trying to keep busy. I will say that in post-op, I learned something in pre-op that I had not heard anybody say before. And I found it very, very interesting. On my last pre-op appointment, it was a group meeting with a psychologist, and she was going over things you could expect, things that sometimes occur. What I didn't know is that a lot of women particularly experience mood swings for up to 6 months after surgery. And I've not ever been one given to mood swings. But she brought out something that I didn't know before, and she said estrogen is stored in fat cells. So as you begin losing the fat, the estrogen is released into your system. And of course, estrogen is a hormone that can cause heavy mood swings. And so she said, just be aware that if you start experiencing real highs and lows and mood swings, erratic mood swings, a lot of times that's the reason why. Well, I haven't been experiencing mood swings, but I have been experiencing some really weird dreams. I mean, 2 nights ago, I had a dream that I got in a brawl of fisticuffs with my older brother. Now, my older brother could take me out, no question. But we got into a fight over who got to eat the second foot-long sub sandwich from Subway. I love Subway sandwiches. And in my dream, we were sitting at Subway, and we had both already finished a foot long. And there was for some reason, there was an extra foot long. And it was a veggie. It had lots of onions, lots of jalapenos on it, just like I love it. And we got into a fight over, because we both wanted the second foot long. Crazy dream. We settled the fight with we each got half. So, the first couple days out, I wasn't hungry, and my stomach wasn't hungry, but my mouth was really hungry. I wanted a grilled pork chop with lots of spices on it so bad. And I didn't even want to eat it because it freaks me out to think about eating something solid and putting it in my stomach. I'm not going to do that. But I just wanted to lick it. I just wanted to have the taste of it in my mouth. I didn't do that because when my son brought me home from the hospital, I made him clear everything out of my kitchen except just the stuff that I could have. And so my kitchen is completely bare from food except for those specific items that I eat during my 2-week post-op. So pudding, sugar-free popsicles, which I'm not digging too much. I did get some Cool Whip because that's only 2 carbs per serving, and a serving is 2 tablespoons. There's no way I'm going to eat 2 tablespoons. I have some sugar-free Jell-O. So what I do is I might take a couple spoonfuls of Jell-O, put it in a bowl, put a little Cool Whip on top of it. And when I talk about a little bowl, I'm talking about a little 3-ounce bowl. And I'll put some Jell-O in it with some Cool Whip, and I'll eat 1 or 2 bites, and I'll set it aside, and usually just about the whole thing is left. And, then I'll just have to go put it in the sink, and I never eat the whole thing. There's no way. But I did have some food cravings. They're kind of gone away now. I did dream last night about some pizza. Pizza's on my mind because I love pizza. I must have seen a commercial or something right before I went to sleep. A big pepperoni pizza or a big vegetarian pizza. So I try not to think about food, but I did notice that there's an awful lot of commercials on TV that deal with food. But it's really not bothering me that much. My son came over and he said, I'm really hungry. Would it bother you? Would it be okay with you if I stopped off and got, a cheeseburger, whatever he's getting? Would it bother you if I brought that over and sat down and ate, or would you rather me just eat before I got there? And I said, no, that's fine. You can bring it over. And he brought it over and he ate, and I didn't have any problem with it at all. Although he did have a bag of potato chips, salt and vinegar potato chips, and I wanted to lick one of those. But he wouldn't let me. He said, no, you can't. And so I didn't. And everything was fine. So I just want thank you so much, all of you that are watching. I just wanted to check in. Please leave your comments below if you have questions. I'll be more than happy to answer them as soon as I figure out how to do that. Like I said, I've got this new laptop that I'm posting videos with now. My phone kind of died with the video player, so now I've got to learn how to use this camcorder on this video recorder on this laptop, and I'll be able to get into my YouTube videos. I'll be able to post stuff. I'll be able to answer questions. But in the meantime, if you're watching this, please hit the like button, and don't forget to subscribe. Now, I will tell you that I don't know why it's important for you to do those things, But I see everybody else saying it on their YouTube videos, so I thought, well, if everybody's doing it, then it must be important. So be sure to click like and be sure to subscribe, and then I'll figure out the whole Instagram. I don't even know what Instagram is, and everybody says, follow me on Instagram, on Facebook, on Twitter. Well, I've got a Facebook account, but Twitter I've never been on, and Instagram I have no clue on. So I'll figure it out as I go along. So until later, thank you so much for watching. Please leave your comments. I do like to read those. I will respond when I figure out how to. And until next time, have a great week. Enjoy your life. Find something good about your life today and enjoy it. And whatever you do, in the midst of your enjoyment, don't sweat the small stuff. From the greater Seattle area, this is Ma Barker saying, we'll talk soon.